Okay, we're going to go ahead and get started. I'm Angie Anderson. I am the COPD Program Coordinator here at Sarasota Memorial Hospital. And we have today Dianne Lewis. She is the COPD Breathe Strong Coordinator. And she's going to be taking us through a presentation on COPD and how to manage.
And what we're going to do today, we're going to use the manual. So the slides, the exact same thing should be up here, or at least most of it. There may be some additions to it. But this is yours to keep, to take home. Because as you go in, the first page, let's make sure I get it right here. Well, there's the front. This is just a pre-test, and I mean, for you all, we do this a lot when it comes to like respiratory therapists we may be working with, or nurses that we're working with, OTs, PTs, because we want them to become familiar with COPD Breathe Strong. And we are part, COPD is, Breathe Strong is part of the COPD Coalition. It's a national non-for-profit organization. And COPD Breathe Strong, our whole mission is to educate patients, caregivers, and providers on COPD and how to keep the patients happy, healthy, and out of the hospital. That's our primary mission.
I'm fine.
One of the reasons that we developed this, because you're going to see as we go through, it hits the majority of topics that you probably have had questions on, or unless you're newly diagnosed, that you will have questions on in the future. And this wasn't something that was thrown together in a short period of time. It took about 3 years.
Wow.
And we still make changes in it, probably about every 6 months. You just got our new ones again. So we're always trying to make it better. This talks about COPD, chronic obstructive pulmonary disease. And it is a progressive disease of the lungs that may be chronic bronchitis, emphysema, or they may have some components of each. The progression, because it can be slowed, but it's never stopped. So that's why we always tell people, please stop smoking, because at least you can slow down the progress.
Why is fibrosis not
Pulmonary fibrosis is a respiratory disease, not considered a chronic obstructive pulmonary disease, but pulmonary fibrosis is getting more common. We see patients, we also see alpha-1 antitrypsin.
I'm sorry, can you say that again slowly? It's not considered...
It's really not considered a chronic obstructive pulmonary disease. Pulmonary fibrosis, I think, is probably more of what you call a restricted disease.
Yeah.
Restricted meaning, in your COPD patients, they have a problem getting air out of their lungs. They might be able to take a breath in, but because either from emphysema, their air pockets are weakened and have gone into a bigger air sacs, rather than those nice little millions of alveoli, they're called, in your lungs where all your gas exchange takes place. And then the chronic bronchitis patient has more inflammation. They may have more secretions, they may cough more, but these patients have problems getting air out. And we're going to show you some of the methods to help with that.
But fibrosis...
The pulmonary fibrosis is called a restricted, so they normally have problems breathing the air in.
Because doctors aren't sure if I got fibrosis.
Okay, all right. And that's what happens. Sometimes you'll have a combination of things.
Yeah, a lot of the symptoms are the same.
Yes. And COPD, 85% of COPD deaths are caused by smoking. It's the #1 cause of chronic obstructive pulmonary disease. You can also get it though from other factors, indoor air pollution. If as a child you were around maybe a parent who smoked, you received secondhand smoke, but there all can be genetic factors. The genetic factor is the alpha-1 antitrypsin, which is another type of lung disease, and a lot of times it will mask itself as chronic obstructive pulmonary disease, and patients may be told they have that unless they are tested for the alpha.
benefit of being tested?
And because you treat it differently,
Oh,
okay? So, and it's a genetic, it's an inherited disorder.
and
Where this COPD itself is caused by, most of it, by smoking, air pollution of some type, or exposure like to chemicals, just minors.
And why don't doctors want to do that early on, as soon as they make a diagnosis?
They just don't always know to if they're primary. Pulmonary will, but it's just your primary may not always have that in there. You know, they're looking for your overall general health, and they can definitely treat, you know, the early stages of COPD. But as you progress and go on, I would always recommend that you look for a pulmonary doctor.
And it's a matter of just like a blood test.
Matter of fact, we had a seminar last weekend where we had respiratory therapists come in the morning, patients and families coming in the afternoon, and we actually had a testing station there if anybody wanted to be tested. So, as we have seminars like that in the future, we're definitely going to let Angela know, because we present like 2 or 3 hours on this book rather than just an hour, and we probably won't make it through everything today, but we'll do our best. Because we want to provide some of those services. We sometimes do spirometry testing at those. So it's just a nice little additional information. How many have had a spirometry test yet?
Is that pulmonary function test?
Yes, I know. Is that where you go draw breath in on the thing that looks like a plastic?
No, that's an incentive spirometer.
Oh, okay.
No, this is actually, you're hooked up to a machine,
Oh.
and they'll actually do a series of tests on you called pulmonary function test, and it will help tell you, you know, where you are and how well you're doing as far as your COPD. Because if you're early diagnosed, that's awesome. But we have so many people walking around here right now that don't even know they have COPD. 58% of the COPD patients, believe it or not, are now women. You know, years ago, and I think a perfect example is this, is that if anybody watched the show or has watched the show Mad Men, where they're all smoking all the time, everywhere, that's the way it was back then. And most of them were men. You did have women, but now COPD kills more American women than breast cancer and diabetes.
So men gave it to women initially.
Women took it up.
Safe to say.
Women took it up. That's what's sad.
Yeah,
Okay.
right.
And I mentioned this already, got ahead of myself a little bit. Patients with lung disease have 2 major changes. Like I said, the alveoli, which this is a great picture over here. This is quite healthy. When you get to the very ends of your lungs, where it meets the capillaries and you're actually, oxygen crosses over into your blood and carried to your body, healthy ones look like this. You've got millions of them. But as they break down, these become bigger and bigger and bigger. And so they end up snapping closed when you exhale and aren't allowing you to get the air out because it's lost its elasticity.
Oh, wow.
Yeah. And that's the emphysema. Chronic bronchitis, like I said, you have more swelling, you have more mucus production, more coughing. So they're a little different, but most of the time you won't fall just into one. You're going to have a combination of the two. Like we just said, 15 million have the disease that don't know it. They're walking around here right now. COPD management program. This I won't go over a whole lot, but when we talk to other companies, especially like home health agencies, we are linked up with another organization called Encore Health, which, have you heard of telemedicine? Yeah. Have you heard of different monitoring systems that you can have in the home? Congestive, oh, I'm sorry, I turned it off, I think. Congestive heart failure patients, a lot of times will have some type of scale. They'll have them do their weights. They'll have them, I'm trying to think what all, blood pressure. What else do they do, Angela? I forget. But anyway, and this company is definitely working with other companies to look at monitoring COPD patients in the home. Okay? and looking at things, believe it or not, as crazy as, okay, this patient didn't sleep through the night. We saw where they turned on their lights 2 or 3 times last night. When normally they may get up and go to the bathroom once, but this night they turned it up 2 or 3 times.
But that can be really important, like with sleep apnea and all
Sleep
that.
apnea, or they're not
That's really
sleeping
bad.
well for some reason. Are they starting to get an infection because of that? So it's crazy little things like that that we don't think about that can be watched. Yes. Okay, here's some things we probably want to talk about. How many of you been instructed on pursed-lip breathing? You have been? Okay. We like to say this is smelling the flowers or the roses, blowing out the candles. And what you do is, it's like a straw, okay? So you're going to go in through your nose, slowly, and then you're going to exhale through your lips, looking like you're sucking on a straw. And if you could do a longer exhale than inhale, like an inhale maybe 1, 2, exhale 3, 4, 5, 6, or as long as you need. And what that does is that helps keep those little alveoli we were talking about that are closing. It creates pressure in there, keeps them open, so you can get more air out. So in through your nose, out through your straw.
So you shouldn't be breathing out of your nose?
Oh, you can breathe out of your nose, but this will help you in case you're getting short of breath. And you can stop, do this breathing, and it should help. Because if you're walking and you get short of breath, stop. Do your breathing. Okay? So no, otherwise normally it's better to breathe in and out through your nose because your nose is your natural filtering system.
Okay.
But this is a breathing technique to use, and a lot of COPD patients use it when they get short of breath or have what you call flare-ups. Okay? Pursed-lip breathing, that's called, because you're pushing your lips together. The other one is belly breathing. And I don't like to do that laying down so much, but what you do is that you put the palm of your hand on your belly, the other one on your chest. Now when you take a breath in, your stomach should expand. When you breathe out, and you can do the pursed-lip breathing with this, then your stomach retracts or goes back in. Your chest here shouldn't move much at all. Okay? So let's take a deep breath in through our nose. Use your belly.
Just from my experience with patients, they have a really hard time with this because they want to do it backwards.
Yes.
With their muscles in the
Yes.
belly. They want it to
Yes.
go in when they're breathing in and out when they're, the opposite.
And they teach you this because you have become used to doing that. Breathing up here, using what's called your accessory muscles. Your muscles that you see, like if you're real short of breath, you'll see some people going, no, this is sticking out.
Oh, is that what?
Yeah.
Yeah.
I haven't seen the patient seem like,
That's when they're getting short of breath. Now, if they do their pursed-lip breathing with their belly breathing, and you put your hand here because you don't want to use your chest, you want to use your belly. So if you can incorporate those two together and they're getting short breath, whether it's you or you see a friend, this should help them because they have learned to breathe up here.
So 4 or 5 times. Any drawback, to pursed-lip breathing 4 or 5 times? Any drawback to doing it?
Well, other than
20
you
or
don't want to
30
do
times?
20 or probably not, unless you're really short of breath, because it will tend to blow off your what's called your CO2, and it could make you a little bit lightheaded. Okay. All right. But
So-
just do it until you feel like you're not short of breath.
Sometimes I do a meditation and breathing.
Oh,
in and
yeah.
out.
Oh,
And I
yeah.
thought, so should I do
This
this
is
for
the-
20 minutes? while
Well, this is
meditating?
the type of breathing they probably want you to do. They want you to use your belly.
Yeah,
when
but
you're
not
doing yoga. Won't hurt. I do it on the tennis court. Yes, if I see that I'm getting short of breath, and I'll turn my back and go, because I know I can get more air out. And I'll get more oxygen in. Okay, and this is just about a good cough. Again, this is in your manual, but you can sit comfortably in a chair. Some people like to keep your back straight and maybe lean a little bit forward. Again, place your hands, elbows, and lower legs on your knees or over a table. And again, let your belly push out. Okay? Then you hold the breath for 1, 2, 3, 4. And then instead of one big cough, we're going to do 2 or 3 in a row. And this is good for patients who have more than chronic bronchitis and a lot of secretions. Because a lot of times one big cough, and how many times have you had a cold, and you try to do that one big cough and then it gets stuck right here. So do 2 or 3 in a row.
Just a real quick squeeze.
Yeah.
My husband has pulmonary fibrosis.
Okay, she was just mentioning that.
And
Yep.
so is that also good for PF cough?
Yeah, it should be, yes.
Yes.
Okay.
And anytime where you feel the mucus is trapped there and you can't get it up and out, the kind of forces it up, so you're able to expel it, get rid of it.
Because those secretions are usually in the larger airways, not in those small little sacs at the emphysema patients. I mean, we have those sacs, whether you're chronic bronchitis or not, but the secretions normally are higher up in the airways.
Oh, you mean in PF?
No, in chronic bronchitis.
Oh, chronic bronchitis.
The secretions tend to be higher up. And so
Oh,
you want to
okay.
move
Right,
those
right. That
up
makes
and
sense.
get that out. A lot of people don't like to do that. They don't like to cough it up, but go into those patients' rooms still and say, cough that up. Do you need a Kleenex? Do you need a pen? You got to get that out. These are just some different devices that we let patients know that if your doctor is recommending some of these, and if for any reason you can't find them, because sometimes you can't. Now the Arabica is a little nebulizer. I'm sorry, that's the positive pressure device. But sometimes, I mean, those are becoming pretty common. This one is not too common yet. This is an incentive positive pressure therapy, a little bit like the incentive spirometer you've had in the hospital. This is a PEP device which uses vibrations, again, to help get secretions out. So anyway, what we're telling you is we can help you get these in the future if for any reason you would need them and couldn't find them. We can point you in the right direction.
What does that first one do?
The first one up there is, it's a muscle training device. And again, these should be in here, or we may have
Oh,
changed
okay.
the companies, let's
Okay,
see.
that's all right.
No, that's all right. I just want to make sure these are in here. Yep, those are the ones that are in here.
Okay,
Okay.
sure.
But that's a muscle training device. Okay, so they're coming out with all kinds of things. And doctors like to try to use the new ones to get patient input as to what you think about it. Okay, whenever you're talking about your nutrition. Now this recommendation on these next couple of pages deal with patients who are losing weight because of their COPD. I know, I wish I could lose weight. Because what happens is people usually use 36 to 72 calories per day on respiratory muscles, mainly your diaphragm. Okay? People with COPD can use up to 10 times that. So if you're using a lot of energy to breathe and you're not eating well, you're going to start losing weight. Now you will have some people that won't have that problem, but the bottom line is these are just suggestions on things if you're losing weight, but always talk to your doctors. Talk to your dietitian if you're here in the hospital or come to classes here in the hospital. They are a wealth of information. A wealth of information. This just talks about a little bit of everything. The important thing is, I saw something the other day where it said, I always say eat 3 or 4 times a day, but I saw something the other day that I recently read that said grazing is good. Because you don't want to overeat. Because when you overeat, you're going to restrict your diaphragm. Okay?
Why, Greek yogurt versus regular yogurt, is there something?
There's more protein. All right, walking. And again, we always suggest, this is a plan, is only a suggestion. Please ask your doctor for any type of approval. But you need to learn to use your breathing exercises as you're walking if you get short of breath. If you're not there yet, then stop when you get short of breath. Do your breathing exercises and start again. We recommend just starting out with 5 minutes. Okay? Stop and rest, walk back. And then you increase it to 7 minutes. The other thing that's good is these new Fitbit Trackers. If you don't have one, they make pedometers that are really inexpensive anymore. And track your steps. Track how much, because it can. Some of those can also give you heart rate. I'm trying to think what else. I don't think respiratory rate are on any of them, but besides the steps, they can give you some signs, some vitals, I should say, that are good. And again, this just goes into week 3, week 4, and we laugh and say, you start out with, I think that's supposed to be right. Doesn't look very good like one. And then you go a little faster, and then the gator running. And that's when you've progressed. But again, always, always, always check with your doctor. These are just recommendations for you. Lower body exercises. And again, as we did these, and so I'm not an expert at some of these, we got input from OTs, PTs, because we wanted experts to help us with these.
What is an OT?
Occupational therapist.
Oh, okay.
So you have the occupational therapist, you have the physical therapist. And I was working in Lee Health until just the end of October in case management. And we really had a lot more OTs helping us in the hospital than PTs. Because we always wanted them to assess our patients before they went home, just to see how their mobility was, how their stamina was, how they got from bed to chair and things like that. So that's occupational therapists and physical therapists. So I'm not the experts here on this, but again, the thing to remember is you're going to start slow, you're going to work up. Always use your breathing exercises wherever you can, okay? And it shows you how to breathe in, breathe out when you're using, and you can even put weights on there as you progress, as it says. And this one says, when you perform 8 lifts in good form, increase the weight. Okay, more. This one strengthens the muscles in the back of your thighs just by flexing and bending. Okay, you'll be surprised. You should do that when you travel. Flex and bend.
Hard in an airplane.
Oh, it is hard. But I sit there and do it too, just because, you never know when you might get a blood clot because you're not up and walking around. I'm sorry, did you have a question?
No, I read the 3B. Move your...
Without moving your leg. Yeah, what they're saying is, hold on to the back of the chair. I'll do it from the side. Without moving your leg, just pull your...
But you could go much further than that.
Mm-hmm.
So
but I'm not the one that's maybe doesn't have the mobility.
Oh, but if you can, you should. Or could
You pull it up as close to your thigh as possible. Now, some people may be only able to get it here.
Really?
Oh, depending on and if they have, COPD patients, believe it or not, can have several other diseases besides COPD. Arthritis is common. Heart problems are common. So that's why we tried to get the focus of other healthcare professionals besides us, because usually patients just don't have COPD.
That's true, I have that vascular insufficiency.
Okay. All right. They could have, what am I trying to say? Brain dead. Circulation. Neuropathies, yeah.
Yes.
Neuropathies, where they don't have good circulation in their legs, maybe in their hands.
Yeah.
So there's all kinds of things that smoking does to your body other than your lungs. Okay, and these are more upper body exercises. And even here, here's one where you can use a broom or a cane, whether you're sitting in a chair, and the weights. And again, I'm going to let you read those and look at those. They're very easy, shows you pictures. And we tried to make it funny as we went through here too, putting that face, the smiley face or whatever on the person. And it tells you how many repetitions they recommend that you do. And it even says here you can add a ½ pound of beans in a sock and help with your lifting with a dowel rod. Okay. Upper arm strengths, leaning against the wall, basically doing almost like little push-ups against the wall. This is interesting in that, like I said, we're under the COPD Coalition, so this talks a little bit about them, but the picture is what I find interesting. And you're going to find out as you go to different programs, or your doctors may even talk about this. Angela may even be doing this. I know some pulmonary rehabs are, where they're teaching them to play harmonicas, because they have found out to use a harmonica. And what are you doing? You're taking a deep breath in, and how are you blowing out? To make that sound in a harmonica, you're basically doing pursed lip breathing. And so some of the clubs around, I mean, the instructors have to go. Bob, matter of fact, who's my partner and really is the one that works with Angela normally, is learning harmonica. Because as we do these programs and stuff, he wants to be able to show them. And so that's what this is. This is a picture of the different, and we even had a couple of years ago, I'm a registered respiratory therapist, at our national respiratory meeting, we had a country western professional singer, and he joined us because he had a family member who had COPD, and he also knew how to do the harmonicas. So he got up there and played the harmonicas with our patients who had come to the program that day. So, great exercise.
I've heard singing is also very helpful.
Anytime you're using your diaphragm, and oh my goodness, yes, because you're exercising that muscle, and that's what you want to do. Because over time, like we said, you've learned to breathe up here, so this muscle is not as good as it used to be. And so that's why, yes, anything that's going to exercise that abdomen, strengthen it, and help you do your breathing better. Okay, now this is kind of important. How to stay out of the hospital. And this is a checklist that we tell patients to look at. And it says, I will call my doctors as soon as I notice the sign of my COPD becoming worse. More breathless, less activity, increased or thicker mucus, more coughing, poor sleep and appetite, or maybe using my inhalers or nebulizers more often. How many of you all have inhalers? Anybody have a nebulizer at home? Okay. All right, that's okay.
What's a nebulizer?
A nebulizer is just a little compressor and that Aerobica can also be used as one. They're making them smaller and smaller to travel with. And you get liquid medication, and you actually put it in a system, and it makes a mist. You breathe that mist, it goes down into your lungs, and it's an alternative that some patients can use, because sometimes these inhalers, and we're going to get to those, are expensive. And if patients can't end up affording their inhalers, that's a real problem. So then that's when you look for an alternative like a nebulizer, because those liquid medications are covered. But not all of the nebulizer, or not all of the inhalers have the same ingredients, the same medication. So that's why always talk to your doctor if you ever do have inhalers and are having problems paying for them. I'm taking my medications as ordered by the doctor, and remind yourself to do so. Some people like a list, some keep a list on the refrigerator, and you need to bring your list with the doctors. I've even seen them coming in the doctor's office with a bag full and all their meds are in there. I don't have a problem with that.
Or even the phone.
Put them in your phone, yep. I have a little card I got, I don't know how long ago, that I still carry around in a doctor's office, and it said, write your meds on it, and I still to this day update them or take off. So yes, so let your doctor know your medications and what ones you're really taking or having issues with. Alerts, and the other alerts that you could, or like you said, using the cell phone, that's what I was trying to get to. Using the cell phone, I'm bad about taking my nighttime medications. And so I've had to start setting them right by my bed, because I just forget them. So, set alerts then.
Before you leave this page, can I ask about
Sure.
sleep? I don't know if you have
Sleep?
any specific wisdom or anything. I'm having some sleep deprivation real issues. I'm like waking up every 2 hours on that clock. And my psychiatrist knows it. He's working on my meds. My primary care knows it. I haven't seen my pulmonologist yet.
Okay.
And I don't know what, I had a hospitalization recently, and since that hospitalization, and I had a fever at home too. So I have really not gotten back to.
Did you go back to sleep?
It's interesting, but most of the time, I get up, go to the bathroom, get some water, and then I go back to sleep, and I fall asleep right away. And like this morning, last night was an example. Went to bed at 9, got up at 11, 1, got up at 4, and this is just total automatic. Like something's messed up, Arcadia systems or whatever. Anyway, at 4 o'clock I said, you know what, I'm done. I'm done watching the clock. But I went back to sleep every single time. And there's nothing else that's changed, you know, there's no TVs on, no cell phone. Occasionally I'll put the cell phone on only to do thunderstorm sounds.
Are you on steroids right now?
Am I what?
Are you doing a steroid taper? Like steroids?
No, I've been all, well, I was for 2 weeks.
Okay.
Yes.
Sometimes that's enough that it kind of throws your body out of
Plus I
whack.
was on tons of them in the hospital.
Yeah.
Steroids are a wonderful medication, but they do have some of those bad side effects.
So how long does
And your
steroids?
pulmonary doctor too.
They usually taper them off, but usually within a month.
Well, I had a week's worth after I got out of the hospital.
Yeah.
Okay.
Usually no more than 7 days. But still, it's just a tapering
Yeah,
process.
but she said a month.
But yeah, usually a month after you're hospitalized to get, everything out of your system and get where you're out of that flu.
It's going on.
He'll probably want to do a sleep study. There might be some sleep apnea going on.
There is sleep apnea, and I do keep oxygen at night.
Yeah.
Um,
But a lot of people, go to where they have to wear a CPAP machine, which forces the air. It's a little different than just regular oxygen.
Angie, I've never had a follow-up. I had a sleep study, meaning you wear those little box like Holter monitor. And that was the only sleep study I had prior to going on to the oxygen. But since I was put on the oxygen, nobody ever checked to see if the oxygen was working. Or, I have no way of knowing. Some mornings I get up and I do my pulse ox and it's 80 or something.
Yeah.
Yeah. And that's the best, we always say, your answer's at the tip of your finger.
But I'm also very restless, and sometimes I know I just turn it off. Because I get tired of wearing it, that's why
You take it, but what you might do, if you keep your pulse ox in to remind you, when you're awake at night, take it when you wake up and see what that is, because if you're dropping, like Angie said, then he's probably gonna want you to have a sleep study.
Yeah, I hope so.
Yeah, and the thing is, don't think it's terrible if you have to have a CPAP, because, and the other thing I tell patients is, a lot of patients say, I can't sleep with it on, yada, yada, yada. You have to realize there are hundreds of different masks, nasal devices, so don't give up. Now, if you have a mask for a month or so, they may want you to pay for the next one. But you guys, the CPAPs make a difference in, if you're having sleep apnea, it can create heart problems, it can create diabetes, it can create renal problems.
All night long.
That could.
All night long.
And some of your medications may do that too.
Yeah,
So, it's amazing what sleep apnea does to the body.
Oh,
So,
apnea gives you cramps?
I don't
She
know,
doesn't
I'm
know
just
what it is.
having horrendous cramps.
Are you on a cholesterol medicine?
Yeah, and let me tell you, a friend of mine says, oh, you know what, just put a bar of soap in your sheets. And I did, and it worked.
Seriously?
For about 10 days, it worked like a charm.
Just a bar of soap?
Right, last night,
Was lemon scented?
no,
Heavy
it
scent?
doesn't matter.
No, well, I'm wondering maybe it's scented.
No, mine's
Yeah.
Dove. Mine's Dove.
Oh, so it does have an aroma.
Yeah.
Okay. Because I tend to, it's just, I don't know.
But the point is that it worked every single night up until last night. And last night I had one in each sock and I'm walking around in. Yes, yes, and I've asked several people, even Dr. Gabriel, she said, no, I don't think so. Well, it could be the placebo effect on me.
Well, it's like under the sheets, or did you say in your sock?
I put it in, when it didn't work under the sheet, I put it in my socks.
Oh.
So up until last night, yes, I'm saying that it worked for a couple of weeks.
Oh, it's like a aromatherapy.
I don't know.
Remember?
That's a new one. Anyway, this is just continues with the doctor's checklist, you know. I will balance activity and rest. I will walk, as we talked earlier about the walking. I will check my, now your equipment we're going to get into if we continue to have time today. We may have to do half of it today and half another time when Bob comes back. But we talk a lot about oxygen and how the companies need to maintain your equipment, what kind of portability you have, and how you got it, okay? And see your doctors to get your fluid ammonia shots. I've got both of mine already. And you got to get a complete physical at least every year. And I know some doctors, depending on what they're treating for, you may want to see you more often. Okay, this is just talks about COPD flare, bad day versus COPD flare. They call them different things. Exacerbations is what we call them in the hospitals. And again, this is a little bit of some of the same things that we talked about on the other page. Know what may cause a flare-up. Believe it or not, weather changes. Red tide. I know, it's been awful down where we are. Seriously,
Yeah,
out of
it's
something?
been bad here.
Oh, boy. Because that stuff basically is robbing the water of its oxygen. So guess what it's probably doing to the air? Just FYI. So yeah, weather changes can definitely have an effect on you, or atmospheric changes. If you live by anything that's polluting the air, any plants or things, yeah. So be careful with those. Let's see, what else? Sputum, of course. Not always the color can tell you if you're getting an infection, but if you're having more and thicker, it doesn't have to be yellow or green. Okay. Hands and feet are swelling. Okay. Tips to do: wash your hands. Wash your hands, wash your hands, wash your hands. And the thing is, you get things on your hands you don't realize. When you go to a restaurant and read that menu, look how many people have read that menu. And now we're getting ready to eat. That's why I carry my Purell in my purse, or after I order. Go wash your hands. Airports here lately, have you seen those studies on the airports? And those little bins? Ooh, one of the nastier
Oh, the
than
one
the
that's going through
toilets.
the X-ray.
Nastier than the toilets. Nobody cleans them.
Oh, funny.
So,
Okay.
wash your hands, wash your hands, wash your hands.
I always get upset when they put your silverware on the table when you're eating.
Oh,
The
yes.
table,
Yes.
and they washed it with
I want a napkin
Oh.
and then put my silverware on the
Yeah.
napkin. Yeah, so there's things like that you just gotta. So.
Wow.
Bad trigger days, COPD flare-ups. Okay, if you're using your inhaler a lot, now there's different types of inhaler. You've got your maintenance inhalers, you've got your rescue inhalers, and then you've got your steroid inhalers. And again, we may not get to all of this today, but especially your rescue inhalers, are you using them more? And if you're not on inhalers yet, good for you. Hopefully you won't be. Okay. Stop smoking. Have you, anybody stopped smoking? Hopefully all of you stopped smoking.
I've never smoked.
Oh, really? So are you just a friend, or was yours caused by pollution?
I don't have anything, my husband does though.
Oh, awesome, so you came for him.
Mm-hmm.
Wonderful. Wonderful, okay. And have an action plan into place and know when you need to call your doctor, know when you need to go see him. And last but not least, ER is the hardest place to go in and get treated fast. Oh my gosh. It just, especially this time of year. I know I saw some patients coming up to the floor that had been in the ER for like 2 days.
You're kidding.
No, because down in Lee County, I mean, we've got 4 hospitals there, but it's during season, they're just all overflowing. And I bet Sarasota's the same way during season.
Yeah, it's always better to go to an urgent care, unless it's, you're really
Sick.
struggling with
Yes,
air
yes.
and need emergent help. But it's better to go to the urgent cares if you just need a treatment or you feel like you're getting sick.
Okay, this talks about, and I'm going to jump down here, conditions for when oxygen therapy may be covered by Medicare and insurance. You have to have a certain condition, one of which is COPD, that is qualified. But then with that, you have to have an arterial oxygen saturation of 88% taken during sleep, awake, or during exercise. That means that little oximeter on the tip of your finger, that tells you when you're getting, if you're getting 88% or less, you're having some issues somewhere. Either you've been walking, you're starting to get an infection, so, and of course how you feel. If you've got 88% and you feel great, well then just try it again a little bit later. Try it on a different hand, a different finger. You'll be surprised how circulation could affect that. Oh, he didn't put in the oxygen. Well, we're going to go back and talk about the oxygen. And what this page is all the clubs and pulmonary rehab centers in Florida. Angela should be there. Let's see.
Yeah.
Sarasota. There it is. If we forget any, please let us know. We found out that we forgot the Cape Coral Lead Help Better Breathers Club up there. But this just gives you ideas, and we do this because we not only come here and do some of these programs like for Angela, but like we did that full-day seminar the other day where we had patients in the afternoon from Punta Gorda, a little bit further south, probably North Cape Coral. I don't know if we had anybody further north, but we want them to have that information because I can't say enough about pulmonary rehab programs in that people aren't getting the care that they need in the home from most home health agencies because those nurses have so much to do anyway. They're busy. And I'm not saying that as an excuse, but it's just the way it is. And so the pulmonary rehab programs have really become the educators of most of you all who have COPD. And we're just trying to help. We're out there in the community trying. But these programs, if you qualify for, really, if your husband qualifies for it, see if he'll come.
And once you can get on a list for all of those educational seminars, I know Rodica went to
What
that
I'm
on
going to
Saturday,
do-
but I didn't know about it.
Okay, that's all right, because
It's
what
too
we're going to
late.
start doing, this is the first one that we did. And this was kind of our little trial. And we are now gonna start probably going around the state and having them in different locations. And as soon as we have one that's close, we would like to have one probably up here in Sarasota, if not the northern part of, what's the very far northern part of Sarasota, Kim?
Like Bradenton area.
Yeah, even there. Because like I said, what we did of a morning was we had respiratory therapists and we educated them on this of a morning, afternoon were patients. We had 10 to 12 patients, which may not sound like a lot, but for these programs they are. And the nice thing is when you have these and you talk to other people who were there, I met this gentleman from, I think he was called VA Free, that has worked with veterans in the United States for, I forget how many, he was a lieutenant colonel in the Air Force, across the United States with helping them get their benefits, helping them get their burial, funeral in place. Matter of fact, I'm going by to Sarasota today because my husband already called and talked to him because I was so impressed with him. And when my husband got off the phone, he was just like, oh my gosh, now he does it for free. And it's things like
What's
that.
his name?
Grant, it's either Steelman, oh, just a wealth of information. And it's things like that, just when you sit and talk to other people that attend these. He wasn't there, he was with his wife who had COPD. And she had the early stages, so she'd stopped smoking, so hopefully everything. But he is, and I've already talked to Bob about maybe we need to get him in that guy in our programs. So, all right. Now, is there questions, or do you want to talk about oxygen, or you want to leave it open to questions? Because unfortunately, in your book is oxygen. Bob may want to do that the next time he's here. I don't know when.
I personally think you can't get enough questions about oxygen. I have billions.
Well, let's go there. No, let's go there.
If these ladies aren't on it yet, then maybe
Well, then we
something
can
else.
talk for a few minutes after if you want.
Okay, yeah.
We'll look through this book and tell me where you do have questions, because the whole book is not here. Okay? So look through some of these pages. I think we stopped around.
Actually, one thing I wanted to ask
Sure.
is, I take it, now you're not with SMH.
No.
You're with
COPD Breathe Strong.
COPD Breathe Strong. Oh, and this is codbreathestrong.org is your website.
Mm-hmm.
To stay, now is all this info also on your website?
I don't think the patient guide is, but I may be wrong. I haven't looked at it lately. I'm just being truthful with you because we have been so busy. And Bob's not here because he's off to Tennessee. I mean, we are now spreading across, I don't know how many states. And there's 2 of us.
Wow. I have to tell you, I think
Bob
this
is
is
a shorter version.
No, Bob is another respiratory therapist.
again?
I
It's a shorter version.
Oh, it's on.
Is it a shorter version on there?
I'd say
Just
this,
the name.
I think this booklet is great. Yes.
Everywhere
It was
we-
nice when we switched over.
We
to
take this booklet, they rave about it. And the thing is, like we tell people, like when we do classes like this, we provide them for free. But like, we work with hospital systems, home health agencies. And if they want to purchase these, because this is the only way we make money, we don't get payment for this. These cost a whole $1 to $1.50 each, depending on the quantity the place is ordered. And we've heard so many good things about it, because I've even had a respiratory therapist who was working for a home health agency go, oh my gosh, I'm paying $5 to $6 for the one I use, and it's not nearly this good. Like I said, Bob, bless his heart, has to be given all the credit for this. He has worked on it for 3 years or more. When I came on board, I gave him a couple of more input and things that we did. But like I said, we're just constantly trying to change and improve and update. So are there any other pages in here you would like to talk about then that we didn't get through? I think we stopped about page 12. No, we went to 13.
Actually, one thing caught my eye,
Sure.
partially because one of the pages we didn't cover said something about, I think it was in recovery, put your hand on your chest, and your chest should be going up and down.
Or where was that now?
And so I was wondering when would one want to do that, as opposed to, the belly going up and down.
thought you said the chest stays relatively stable.
Yes, it should, because when you're doing that,
Diaphragmatic.
you're not using your diaphragm. Interesting, I'm gonna have to search through the book now and try to find it. And one thing in this booklet also, if you did not get, this would be good for you since you're on oxygen. Tells you, that is what's called a questionnaire
Okay.
that you can fill out. You're lucky, it looks like, have you got a travel concentrator there?
Yes,
you
I do.
Oh,
Yeah, I've
awesome.
been the gamut of just
Okay.
flying by the seat of my pants,
know.
totally in the dark, figuring it out. I even went on a 7-day cruise with this concentrator 3 days after I got it, and playing with my pulse ox and
You have to, because when you're using it at night, because most of these travels are not recommended for nighttime.
no, I had a concentrator in the cruise ship.
On the cruise ship. I started saying that's what
And
they used to
and let me
do.
tell you, I didn't find out till the last minute, and they say it takes a minimum of a 6-week reservation to get oxygen on a cruise ship. I got one in 5 days.
Wow, that's
But-
awesome.
but
It's whatever
they
company
survived.
they work with, you have to thank them for that, because I mean.
It's called Star Vacations.
Okay.
And they
Because
do just.
that's what you need to do, and that's what we used to do. I was in DME respiratory for many, many years, yeah. And they used to have to get their concentrators on the boat, because at that time, we didn't have a lot of these units.
I don't know what I would have done if I had to figure out when, and pulse, this is only pulse ox breathing. If I'm not pulsing, if I'm not drawing on it.
Yeah, and what she means by pulse ox breathing is, if you're in the hospital, or if you're on a regular concentrator, is your husband on oxygen?
No.
No, okay. At home, you've got oxygen going through that tubing all the time, 24/7. Now, you're not breathing off of it all the time. You're breathing on it anywhere from 15 to 20 times a minute, maybe a little more if you're short of breath. With the pulse dose, it only comes on when she takes a breath.
To conserve,
yeah.
for the purpose of conserving, because
batteries.
this tank is not gonna last forever.
It runs off of a battery, but you do have tanks too that work on pulse dose. So, and that's why you go to a pulse dose system, but you wanna make sure you qualify for one. You just don't wanna pick one up and start using it, because you may be the type of person that, number one, can't get that to come on, because some people just don't have good inspiration through the nose. Or you need to make sure that you don't need continuous all the time. And the answer is always at the tip of the foot. And like she said, when she was checking hers all the time, that was awesome. Good for you.
Good survival.
Good for you.
Oh, I found that.
Oh, did you?
It's on page 13, number 6. And it's counting your breath rate, from the minute.
That's how many
Oh, okay.
respirations, so it's counting your breathing, how many times
Oh.
a minute you're breathing, and you can feel that by your chest rise. Yeah.
Oh, okay. You know, it really inspired me. I just found this such a useful tip, that for those of us who curl over in front of our computers, so I read, when you're curled over versus sitting up straight, it makes a difference. 1/3 of intake.
Yeah.
Curl over reduces about 1/3 of the.
Because what are you doing again? That diaphragm's getting all squished up.
Okay.
So
I
we're
was
breathing
thinking
up
it was
here
just-
again.
Okay.
Yeah.
So it's the diaphragm that curled over interferes with the diaphragm.
Plus, when you sit up straight, it just helps you take a deeper breath because of
And your volume increases, the volume that you can pull in.
it. I think we
and
all
the
tend to
volume
do that if we're not
exhale.
seated at our computer well, so that's why it's so good. And at one time, and this has been a few years ago, and this is when OTs and PTs came in handy for us even in the hospitals, they came around to all of us that sat a lot and made sure that we were actually had good posture, and that, because at the time is when people were starting to get repetitive motion injury or carpal thank you. And so, yeah, that was just one of the things I do have to say that that hospital was good about doing, because they didn't want any of us to have injuries that they could have prevented.
And the chair you're sitting in.
Pardon?
The chair you're sitting in too.
Yes, they did,
Very
and they
important.
recommended for some people to buy that little back support. Some of us had to get the little wrist things, but again, those are inexpensive things that the hospital can do, again, to help prevent their employees from having injuries.
Oh, yeah.
Other questions? I think we may soon be out of our time. We've got a couple more. Did you have anything you wanted to throw in, Angela, or say?
Not really. I mean, I think that going to this book has been really helpful for the patients. It just provides step-by-step ways to exercise, the things to eat. So it covers a lot of different ways that you can manage the symptoms, and live your best, which is good.
Yeah.
Yeah, you know, this reminds me, so I thought this was so funny. But it helps, because so much of this, I think we've seen before. But I found out reading a couple years ago that a Broadway show every 2 months goes through what they call, I forget what they call it, debugging. Because it turns out, as the show goes forward through time, the actors start getting a little twitchy and throwing in lots of little extra motions.
Just say,
or
or
they-
extra comments maybe.
Or they do things on both ends, more of or less of. And so to return the show to its pristine or desired state that they left out, they actually have a debugging. For me, this is kind of a debugging.
That's a
Oh,
great-
remember to do this.
Yeah.
Because I
No, good, very good point. Good point.
I would like to make a suggestion, and of course, this is my first meeting, so far be it from me to make a suggestion, but two topics I would like to hear more on, and I don't know if this kind of group is appropriate for that, would be the oxygen and the inhalers, because if everybody, if people aren't on oxygen and inhalers, then it might not mean, as much to them.
Yes,
Yeah.
this is,
We
go
do
ahead.
have a meeting, one of the groups is on that. I don't know what dates, I don't have the schedule right in front of me, but it
I got it
says
here somewhere.
inhalers.
Yeah, we've done a lot of work on that, so you got a good resource here for you.
Yeah, February 13th,
Okay.
managing my inhaled medications, good and bad days. And I'm sure that we'll talk about oxygen in there. And we can always talk about it, in the next one before Christmas. We'll touch on that.
This has been
Thank you.
very, very informative.
Good.
And I have to tell you, I thought for a second one,
Yeah, I have
You looked a little familiar.
I was a
Okay.
NICU cover for 2.5 years at least.
I worked in the children in NICU. That's probably right.
I held drug, I cut a drug addicted.
Have you been to the new hospital?
Oh, I.
Were you working there
I-
too? Because I was still in the old. Once they transferred to the new, I only worked there a couple
I
of
was
days.
a part of the move,
Oh, my God.
and I saw the first set of triplets going into the new hospital, and the barrage, the entourage of people. I think the administrator probably must have been there too. It was 3 little babies, and each child was individually wheeled through this passageway
Yeah.
from one hospital to the other, from the NICU, to the Golisano Children's Hospital. And so there were several family members to tour with the first baby, tour with the second baby, and tour with the third. It was just, talking about cold chills,
I know.
and every child goes into a private room.
Yeah, they're all private
Large
rooms now.
private room, bathroom, beds, calls it whatever.
It's a beautiful hospital because they
So
have
what's
such.
Health Park?
It's called Golisano Children's Hospital. It's
It's the
right
only
by.
children's hospital between Tampa and Miami.
Any one that has any
Just
levels to it.
opened in May.
Naples has some children, but not of any intensity like this. It's just a beautiful hospital. They just really designed it.
It's all children's and mamas and babies.
Right by Health Park. It was in Health Park till they
That's
outgrew it.
right. So they built it.
Thank you, thank you, thank you. No, thank you all.
Thank you.
Thank you all. Thank you all. Anytime, that's what we're here for.
Now, is your organization, is that nonprofit?
We are a nonprofit, yeah. Yep, and like I said, we do all of this for free. The only way that we actually make money is, we have sponsors, company sponsors that help the non-for-profit side. They're looking at grants maybe in the future, and this is the only thing. So, and we do it for, like I said, bigger organizations that are interested in having, like Angel said, even consistency among their staff.
Yeah.
As to what they teach. Because like I tell people when I'm working with home health agencies, tell your nurses, review this book. If they want us to come in and teach them, we will. Or I said, just have them review the book. When they have a patient, oh, got a new rescue inhaler, okay. Flip to the page on the inhalers. She can just print out like an online instruction on that specific inhaler, and off they go.
It's very comprehensive.
Good.
It says
Thank
that
you.
you can look at the first page and you have a summary of contents, you know, that you can
And flip to wherever you need to go. So.
Thank you. Oh, yeah, you're welcome. You're welcome. Hopefully I'll see everyone in December. Have a nice Thanksgiving.
You know what? I'm gonna take my blood pressure, although there's two machines to make your sugar.
Yeah.